Why would I spend years in nursing school just for me to go and dispense medications and to give injections and to take vital signs? If that's all there is to nursing, then I might as well just go to the hospital and meet all those quacks that are training people as apprentices of nursing. Hello beautiful people, good day and welcome to another wonderful day on this side of YouTube. I spent almost a year in the nursing profession, and looking back at the version of nursing that I came from in terms of training and clinical pre-qualifications, I'm glad to see the amount of advancements that the healthcare profession in general is experiencing. And what's even more baffling, what's even more encouraging and fascinating is the fact that all these advancements, all this innovation, all this came from people who saw a need for a change in place of the problems in the healthcare community. They saw these problems as opportunities and decided that they were going to find solutions. And today we are singing their praises, we are paying them to proffer these solutions. And so I thought to myself, how has the journey been so far? What information do you think would have made it an easier transition for you from being a student nurse to being a practicing nurse? So this video is dedicated to every freshly graduated nurse out there, as well as to those of us already practicing and those people who are looking to come into the profession or who are looking to start their journey to becoming nurses. True, practicing in Nigeria isn't the most glamorous right now, especially in smaller cities in the country where remuneration is almost non-existent. I mean, I hear of states paying registered nurses, licensed registered nurses, 20,000 naira per month, and I'm thinking to myself, is it for Eba? Is it for Gary? Is it for beans and dodo? Hospitals which are able to afford fairer remuneration plans for their healthcare professionals and their nurses, finding jobs in such hospitals require you knowing somebody that knows somebody that knows somebody that knows somebody, and that is not how it's supposed to be. That is not what it's supposed to be. I'm not here to discourage your journey in the search for greener pastures. One thing, however, is not every one of us will leave the country. Not every one of us wants to. And even if we all do, even if we all will, it will happen in time. So what happens between now? What happens between now and then? What do we do to make sure that the version of nursing that we practice in prior to us going to get like educational advancements or getting career advancements in other places, what spice are we bringing in as nurses into the profession? The first thing I would say is, be the change you want to see. True, what we are taught in school is the ideal, but when we come into the world, we get to face the real. But one thing is sure, never compromise your standard of care at the expense of your patients. Nursing is beyond taking vital signs and dispensing medications. But if you internalize that and see that as the only reason why you're called to be a nurse, then the whole time spent in school will be a waste. Why would I spend 5 years? Why would I spend 3 years in nursing school just for me to go and dispense medications and to give injections and to take vital signs? If that's all there is to nursing, then I might as well just go to the hospital and meet all those quacks that are training people as apprentices of nursing. That stereotype is a shadow of the value that we contribute to patient care and outcome. However, no one will see or know this if you and I don't go against the status quo and embody the version of nursing that we would be proud to be associated with. In light of that, I'll say this. There are many faces to nursing. Find your space and shine. Understand that nursing is not confined to the bedside. Nursing is not confined to you always having direct contact with the patient. Don't be in a hurry to pick a niche. It's okay to go through each till you find your space, and when you do, please don't stop till you're the best at it. Don't stop pursuing higher education and don't stop reaching for knowledge, because trust me, it shows. Take certificates, courses, get life-saving skills and licenses, because trust me, it adds finesse to your CV and sets you apart when you start applying for jobs. Join a community or create one. Take your brothers along, take your colleagues along. If you have a job and you hear of a vacancy, reach out to your colleagues that you know are still job searching. Be your brother's keepers. If you find an opportunity, if you find a course that you took that was helpful to your career advancement, tell your classmates about it, tell your colleagues about it, tell people about it, so that every one of us can get all the necessary qualifications that we need. And then the standard of care that our patients receives will be different, because we are people who are learned, we're people who are equipped with all the instruments that we need to carry out care and to be the best version of nurses that nursing has ever seen. This would be a great time to subscribe to my channel. Please like this video, share this video with your friends, share this video with your colleagues, your classmates. drop your comments. You can ask questions in the comment section. If I do not have the answers, I'm sure that other registered and practicing nurses are also watching this video, and they will be sure to send you a response immediately. I'm in Lagos, so let me speak for the people who are in Lagos or looking to come to Lagos. There are groups on Telegram with daily job adverts. I'm going to leave links of those in the description box so you can join in on the ones that are free. Please do not, in a bid to gain experience, settle for mediocre remunerations and toxic work environments. I know that employees in this season where there are new faces in nursing, one of the things that they do is they send out job adverts, a lot of job adverts. The job adverts usually read like this: new vacancy exists for newly qualified registered nurses. Pay, you probably see things like 30,000, 40,000 naira with accommodation, 15,000 naira with accommodation. Say big hospital, blah blah blah, you're going to gain a lot of experience, you're going to this, you're going to that. Please do not, in a bid to gain experience, settle for mediocre remunerations and toxic work environments. It's okay to not get a job the first 6 months after gaining your license. It's very much okay. It is very, very, very much okay. I mean, the least you can do while you're waiting is to take courses. You can take short jobs depending on your location. Abuja, Lagos, Port Harcourt, all the big cities. I know that they usually have locum, so you can be taking those till you get a permanent job. You do not, in short, do not pressure yourself to get a job. If you see an application, if it doesn't suit what you're looking for, please let it pass. Just make sure that you're curating your CV well. Make sure that you're selling yourself, and be honest. Make sure that you prepare yourself before going for interviews, be them virtual or in-person interviews. Make sure that you study the company, you know the kind of services that they offer, you know what your role is as a nurse in such places. You do not have to wait for hospitals to send out vacancy posts before you can send an email to them indicating interest to work with them. And hospitals these days have their websites on the internet, so you just go look for it, find their email, send them a very good email. Make sure you're getting your grammars right, make sure you get your lexical construction and all of that, make sure you're getting all of those right before sending them an email. You can send them an email indicating an interest to work with or for them, and if they're interested with your CV, if they're interested with your audacity, if they're interested, they will send you a mail inviting you for an interview. You go, if you ace the interview, you get the job. They will create a job for you because they want to have good people on their payroll. Get a mentor. This is very important, trust me. Get a mentor. Especially with things like career advancements and all, you always need someone who has been there to guide you. There are great people that are paving way in nursing, and what better way to be at the forefront of this change than to be a part of it? Depending on what you're looking out for. If you're looking for mental health nursing, there are people there. If you're looking to go into research, there are people there. If you're looking to go into nephrology, whatever aspects of nursing you're looking to go into, you're looking to be a part of, there are people who have been there. There are people who are being loud about that. So please, find a mentor, follow them, follow their content, use Facebook, use Instagram, use YouTube, find them, listen to them. Be computer literate. I can't stress this enough. The world is moving away from pen and paper towards electronic health record and electronic medical records. And as much as they are pretty easy to use, they are also very easy to make mistakes using. So you need to educate yourself, not just for that, but I mean, even when you're doing your research, if you're doing research in nursing, you're doing all of those, you still need to make use of the computer. So understand that computer literacy is very important because that is the realm that the world is moving towards right now. So if you do not want to be left behind, please, I beg you, be computer literate. Take courses. Understand that healthcare is moving towards digitization, and especially if you hope and are interested in working in all the big hospitals and big firms and make all those big moves, trust me, you are going to need computer literacy. It is never a loss for whoever learns to use the computer. Above all, remember to take care of yourself. You can't give what you don't have. If you're not healthy, it's going to show. You're going to be clumsy, you're going to be forgetful, you're going to make a lot of mistakes, and sometimes these mistakes can cost you a patient's life. So please, take care of yourself. Welcome to the party, and go make a name for yourself. I'm cheering you on. The links to my socials are in the description box in case you want to connect beyond the comment section. Remember that all you need to do is within you, the world awaits your manifestation. Bye.